Welcome, everyone. Thank you for joining us today for our August AI in Action session. Could you flip to the next slide for me? AI in Action is a series dedicated to exploring research and implementation of AI-based solutions that address the unique challenges and opportunities of federally qualified health centers and other safety net organizations. That is co-hosted by a number of organizations. We are always looking for new sponsors. So if you are interested in joining, feel free to reach out. And just a few quick housekeeping items we'll get started with, and then I'll hand over to Brian and Rainier for their presentation today, and we'll save a few minutes at the Q&A and some next steps. Just a few reminders before we get started. Please make sure that you're on mute to minimize any interruptions. If you do have any questions, feel free to put those in the chat box and we will address those in Q&A. During Q&A, I will also call on people to unmute if you raise your hand, if you would like to ask your question directly. And please disable any external AI note takers. We do have a Zoom AI companion on, and we'll share a summary of the session as well as the recording and slides after the event today. And if you have any technical issues, Wes here from the CCI team is here to help. You can chat with him privately for any questions that you have. Okay, and with that, I will hand it over to presenters Brian and Rainier. Thank you both so much for joining us today. Oh, Brian, I think you're on mute.
Oh, there we go. Yeah. Yeah, thank you very much for inviting us to talk. We're really excited about this conversation. And I know that you generally don't have like vendor combination with health centers, and so we really don't want to make this a pitch. It's more of kind of an educational session, and Rainier is really the star of the show. And so I can do an introduction. My name's Brian Herrick. I'm a family physician. I've been in healthcare technology for the last 20 years. I was a CMIO and then a CIO at a safety net healthcare organization, a regional system. And then 2 years ago, met up with the team from Attuned and really excited to be a part of the team and having this discussion with Rainier. Yeah, Rainier, you can go.
Yeah, thank you, Brian. So, definitely excited to be here. My name is Rainier Pantaleon. I am from the Lowell Community Health Center. I've been in the health industry working at Lowell Community Health Center for almost 13 years now. A lot to do around the call center world, which this is how we have gone into wanting to find new initiatives through the AI world. So I'm very, very excited to be here to share my side of the story and be able to present, what we have been able to create in this partnership.
Excellent. So, just as an overview of what we're going to talk about, we're going to talk about how Attuned generally engages with health centers, just a very quick overview of that, and then some grounding in general AI concepts. And again, these are very, very high level general concepts that we'll be talking about, just to give you kind of a starting base. And then what we'll do is we'll jump into the Lowell specific use case, some of the challenges, the outcomes, and the partnership as a whole. So yeah, we can go to the next slide. So generally, when we engage with health centers, it's a very straightforward process. We have about 3 to 5 meetings with the operational team, and we forward the main line to our voice agent, basically replacing your phone tree or your IVR system, like the press 1 for this and press 2 for that. And we just ask what the patient would like and what they need. And we have a natural conversation with them to understand their intention and what they want. And then we intelligently route them to the right place and get them to where they need to be the first time around. Once we've done that, it really provides a tremendous amount of benefit, not only offloading the call center or the agents, human agents from having to kind of transfer to multiple different places, but it also it decreases the incoming calls, but it also provides all of the reasons of why people are calling your system. And so it gives you a tremendous amount of data about what your patients need and what your callers are looking for. Then we analyze that data and think about how do we automate some of those pieces or expand the use cases of the voice agent. And we work with you to create a roadmap and deepen that integration, building trust with your patients and you, and all the way through the process to help automate and offload more and more from your call center to increase access. Yeah, next slide. So just a general overview, high level simplified kind of look at AI in healthcare. We've been doing predictive analytics for a long time, but with AI, we've actually been able to expand the amount of data and the types of data that we can use to create and augment our predictive models. And that has been some of the first use cases that we've seen in healthcare, and it's been tremendously valuable as we're now able to use unstructured data, narrative data, notes, and things like that to inform the predictive analytics. The next piece has really been around generative AI, where I'm sure lots of you have had experience with ambient scribes or other generative AI solutions where it takes information and it can summarize it in a clear way. So either looking at the patient's chart and summarizing it, looking at a visit or an interaction and summarizing it, drafting responses to patient portal requests. Those types of things are all generative AI use cases. The next step is really using that generative AI to then and adding onto it the ability to call specific information, either to read it or to write back to your EHR or places like that. So that's the agentic model where it's actually taking an action, gathering more data specifically, or writing back to the EHR or wherever you feel like makes sense. And this is used for like appointment scheduling or canceling, refill requests, telephone encounters, all of those pieces is more kind of agentic pieces where it's executing those tasks. Okay, next slide. So when we talk about AI, we want to know that, who's monitoring it? How is it safe? And these, again, are general categories. And within each category, there's lots of variation and variety. But generally, you can have a strictly supervised AI agent where it can actually execute. It's just recommending things and providing information for people to act on. And that's a very high level supervised model that requires human interaction for every step. And then you have with agents, you have the ability to sample or to have some insight into how they're executing the tasks or sampling the model's outcome and what it's actually doing. And you can monitor that and say, okay, these outcomes looked good. We're going to continue to sample that and look over time. The last kind of step is really autonomous. And this is where the agents are acting independently and working without any supervision from a human. And you want to be able to think about these not so that everything should become autonomous. We actually want to think about our use case first and then decide what are the type of supervision models that we want to use to ensure safety. So if you have, for example, something like we're going to prescribe a new medication for a patient, you absolutely want to have that be supervised where the clinician is making the decision because the data is messy and it requires significant clinical judgment. But if you're, say, checking, like someone's calling for a balance of what's due, and all of that information is discreetly documented in one place, that's a very deterministic, clear expectation of, they ask a question and we have an answer. And so that could be something that's autonomous. So you want to think about the use case and how you would use these different models of supervision for those different use cases. All right, next slide. And when you're considering AI and talking with vendors, here are some questions that I would suggest at least being part of the discussion. Is number one, if an agent is acting, how is it deciding? And what type of transparency and explainability do you have into the agent's decisions? Can you actually look and see the logical steps that the agent went through, what data it used, how it interpreted that data, and then what conclusions it made to make that decision? That's a really important piece when you have more autonomous decision making. The other questions that I would ask is, does it act or does it just advise? Is it providing some guidance or is it actually taking some actions? And then if it's taking actions, who's continually monitoring it and checking it and making sure that it's not drifting or changing over time or and that it's consistently acting the way you are expecting? And so those are just some general thoughts around AI and healthcare in general. And so I'll turn it over to Rainier for the next ones.
So thank you, Brian. So a little bit about Lowell Community Health Center. We've been serving the Lowell community and neighboring communities since the 1970s. We serve about 40,000 patients throughout the year. Definitely, we provide a lot of services from behavioral health, PATH for Cariño, Quest testing for labs, OBGYN, vision, and dental services, and many more services. With that being said, we at the call center could be seeing about 1,200 calls come in on a daily basis. Before the AI, we had, a team of 21 members, which meant that we were trying to withstand the volume of calls that we would see on a, regular basis to ensure that we kept the abandon rate, wait times down, because in the society that we live, there's many, many people that are looking for quicker, faster service, as well as service in non-business hours. So before we got into the AI, our organization was just looking for ways to improve the wait time abandon rate. So we tried things of rearranging staffing, doing a call tree, doing all sorts of different styles and different things to be able to improve service for our patients. But what we realized is that none of these options were, working. We're still having the high wait times, high abandon rate. So we jumped on the bandwagon of trying something different, something new, and we, landed on trying out for doing some AI work to ensure that maybe we can provide better service to our patients for after hours, even during our business hours. The system that we use within Lowell Community Health Center is Epic, which is, a system that we recently in the last few years have been integrated and definitely our patients. And now with the work that we're doing with the Tune, we have integrated that together. If we could move on to the next slide. All right. So a little bit about where we started. So when we started with this type of work, we started back in May of 2025. We started with after hours to be able to see if we can find some benefits, to be able to see if this is something that we want to, try out, if we want to actually continue. And we were able to easily be able to reduce the call volume that was entering at the answering service, which was very crucial because those calls ended up going to an on-call provider for items that were not, pertaining to after hours. They were to reschedule an appointment or was to cancel an appointment or just request a refill, but you had enough medications to wait until the next business day. So we started for 2 weeks. We drafted a workflow that I can easily go in there, be able to tweak, be able to add on to. But our patients were able to interact and get some of the helpful information of business hours, be able to get some fax information, and be able to also get transferred to the after hours if it met the criteria of after hours. After we rolled that out, we were able to reduce the volume of calls that were ending up at the answering service to over 66%. And then we decided to proceed on after a couple weeks to business hours to continue to extract, to continue to find and reach our milestones that we try to set in the roadmap. In the business hour scope, that's when we were able to go ahead and add the ability for patients to be able to get transferred to departments such as billing, Quest for lab, and many more departments within the organization to allow to continue to offload that volume of calls that we were seeing at the answering service, at the call center during, business hours. Definitely, we started to see the benefits to that, and we started to see the decrease of volume of calls that ended up at the call center. But we knew that with anything that we do, you will reach a cap on it, and that's when you need to continue to develop and continue to add additional services, additional features within this type of work. That's when we added just this at the beginning of this year, we added the patient verification to allow patients to be able to verify their account within Epic, be able to use their identifiers as date of birth, name, phone number, the AI to be able to locate their account, patients be able to get information as when their appointments are, and be able to also cancel their appointments. So we've been doing a lot of work. We have also now done the prescription refills, so individuals that call are also able to request, refills, and we're, heading in the direction of also to be able to reschedule. So this is a little bit of the work that we've been doing in the last year and couple months to continue to unlock and continue to provide services to our patients, because some of the things that we realize is that for some of our patients, 6 in the morning was the ideal time for them to call, or maybe 8 o'clock at night was the ideal time for them to call. So to ensuring having the ability for individuals to be able to get more and more access at different times of the day when it was more convenient to them, it was definitely, ideal. But with time, we know that demands, leadership do change, which that goes into the collaboration and the partnership to ensure that everybody's idea is heard and that we take that into account. So we are all in the loop, and in a sense, overall, patient safety is kept number one when it comes to all this. If we can go into the next slide. You muted, Brian.
Thank you. Yeah, with our non-integrated operator. Obviously, we're able to deflect those calls from the call center that Rainier just talked about, but we're also able to gain insight into reasons why people are calling. And since we were taking all of the calls to the main number, it really provided a window into the operations of what are the things that people are calling about, what do they need, what's the volume of those, what's the frequency of those. Even you can get down to day by day, more calls of, cancellation appointments on a Monday and more calls of prescription refills on a Friday. You can get into that type of details because it's all native AI platform and you can just query the information there. And so we were able to provide back to Lowell all of this data about why people are calling and the reasons for their calls, as well as breakdown of languages, where we're transferring everything as well. And so we can go to the next slide. Using that data, we then were able to create an automation kind of integration roadmap for Lowell, and breaking it down for Lowell, thinking about kind of what was the quickest value add that we could do for them was appointment cancellation, appointment lookup and confirmation, prescription refills, and then rescheduling. And so that's what we've been working through over the last 6 months about for that integrated use case, and really have seen significant benefits from that. And this is kind of our projection, and that's what we work with each organization to say, okay, here is what we think the value of this integration would be, of this use case would be, and in bringing that to you for a strategic roadmap. All right, next slide. Over to you, Rainier.
All right. So in regards of how we went about this, we broke it down in a simpler version of three phases. Phase one, the routing, allowing the AI to be able to, answer every single call that came in. So at least every single patient or every single caller was getting, service. And at the end of the day, getting self-service, some of the more basic type of questions that maybe our website had available. Maybe it's something that is easily handled as a quick transfer to an available department. It allowed, the AI to be able to, do that type of routing and do that type of self-service for our patients. Also promote, our My Chart to have patients also interact with their care team via that way as well. And then also it allowed our patients to then that were more complex, that require more time, that were not, in a sense, able to use the AI for some of the features that were available. It allowed them to have that, longer time with a call center representative. It really started to offload some of that burden because some of the items and the requests the patient had were things that can easily be self-service. But we knew that with just quick routing, quick transferring to some of the departments within the organization, we were going to reach, in a sense, a block. And that's when we needed to continue to, develop and do the, integration with in Epic to continue to find ways to automate, be able to allow patients to look up their appointments, be able to cancel their appointments, be able to, request medication refills on top of all the other items that were already in phase one. A lot of the things that people tend to get scared about that I can just mention a little bit is in regards of safety, in confidentiality. As a lot of us working in the health industry, that is very important to, keep patients' confidentiality, at point. But one of the things that with the work that we've been doing is, and within the Epic platform, is that the AI can keep track of FYI flags, confidentiality flags, and banners that have been put within the system to allow the AI not to speak pertaining to that account and to route that patient or that caller over to a live agent so they can troubleshoot that request at a safely, point. Also, we know and we have loved ones that sometimes are have technical difficulties with technology and give up on certain technology. If somebody gives up, they can always ask for a live agent and they will be automatically transferred to a representative, because that's another thing. You don't want and individuals, callers, patients to get stuck on a loop and never get service. Overall, you want to build that trust into something that is new in the AI world. And the only way you build trust is for folks to be able to try it, be able to have a good experience, and be able to, proceed. With that being said, we went to, continue, a deeper automation, be able to ensure that we improve some of the qualities. Some of the things that we encounter were, background noise, and just having the AI really be able to, dissect and be able to, help our patients, at all times. But definitely, safety is very crucial, and we have done it in the way we say it is you crawl, then you walk, then you run approach, and we constantly keep meeting, constantly keep diving. But one of the things that I will say is transparency. There's a platform where the data lives, where you're able to really look into what's happening, make real-time edits to ensure that our patients are getting the service that they need. Because in the health industry, things change on a regular basis. And not just to do it in just English, but currently, the AI is helping in Spanish, Portuguese, and we are looking into also turning other languages as well. So more and more of our community, our diverse community, can interact with the AI software, moving forward. We can move on to the next slide. So these are some of the goals and in a sense some of the numbers that we have talked before. So the AI is answering 100% of the calls. So if we have 50 calls hit, our main line, all of them are answered at the same time. All of them are getting the same type of service. Some of them will be self-served, and others will end up going to the call center. Those that are ending at the call center will be assisted by the representatives, but the goal is always to find ways to self-serve and automate as much as we possibly can. Here we when we started, we were able to deflect that 66% of the call volume that was ending at the answering service, that could potentially end up at at an on-call provider level. I really provided the patient, and now with patients, some of the more common things that people are calling is medication refill. I just want to cancel my appointment. I just want to reschedule my appointment. So definitely all these stuff are things that patients currently can do, and it's definitely very helpful. But with all this type of work, has also allowed us to reduce the abandon rate, reduce the wait time, which is a crucial thing, because one of the things that I've realized is a lot of our patients, when they call us, they calling us like they're calling their best friend. They expect us to answer immediately, and at times it's like we want to. It's just that we're stuck with another caller, but we're going to get to your call as quickly as we possibly can. With all this type of work, we've been able to, this allows us to be able to have, in a sense, less FTEs, which are projected, annual savings that are given to the organization during this work. So in regards of, this, I can definitely say that with the work that we've been doing and the partnership that we've been doing, we've been able to continue to expand the services, but it's been very transparent. We have done a lot of testing prior to going live with any type of feature. Um, me and the organization have access to the, platform to be able to look at the script, be able to understand what's happening, acquire data to be able to make, adjustments as we go. So definitely being able to, work and have that constant communication, constant, meetings to be able to make adjustments have been very, very helpful in this, journey that we have taken with, the Attune folks.
Yeah, and I would just say that the benefits of the partnership is the partnership. I mean, I think that the amount that Lowell has leaned in and helped us kind of work through different workflows and iterate and move forward has been just incredible, and getting, real feedback and impacts the way we're thinking about development and bringing that value to our customers. And obviously the language thing is huge from a health center perspective. And we're super excited to be expanding those offerings of language and partnering with Lowell, who is testing those and giving us feedback about the languages. And that's just fantastic. So yeah, I mean, just really the partnership has just been so incredibly beneficial. All right, we can go to the next one.
All right. So some of the lessons that we have learned. I think that having the data, having the access to the platform has been very helpful to allow us to be able to really figure out. To Brian's point earlier when he displayed the reasons of why patients and individuals are calling is very important because it allows you to be able to know like, okay, where do I put majority of my effort? Where do I put the time? What's the next unlock feature that I should be, in a sense, looking for because of the fact that the data is saying, so some of the things that we noticed was going to be, the scheduling or the rescheduling and appointment verification and the medication refill. So that's where we really put in our effort. But we were not able to really notice that or get solid data until we were able to really know, okay, these are the numbers and this is what it's saying. But with all that being said, I also talked about before in regards of safety, in individuals wanting, to speak to a human. Our previous setup was just call, press a language, wait for the representative, but you weren't really getting much out of that. But a lot of our patients, we're able to now start to interact with with our AI agent, which I have not referred to it, but our AI agent's called Samantha. And a little bit about it, and a story that I like to share is we have even had some of our patients bless Samantha because they don't even realize that they're talking to an AI agent. But our staffing, we have been able to provide them the information of why we're heading in this direction and the benefits of heading in this direction. And it's allowing them to really focus deeply with those individuals and patients that require additional time in those calls.
Yeah, and I would just reflect kind of Rainier's comment about safety and confidentiality. Safety is the most important thing that we can do to build trust. And so that is paramount to all that we do. And so I guess the lessons learned was, with that in place, how do you pick a scope that you can provide immediate value and move quickly and learn and iterate together in a safe, monitored environment that really provides that value? And so, that's obviously a balance in how how you approach these projects. And obviously, like you can have the best technology in the world, but if your operations are not set up to be automatable, then you're going to get frustrated with, the ability to automate, and you're not going to make as much of an impact. And so this is a deep partnership, long-term partnership with the organizations to work through their operational kind of set up and work so that we can set up for success to automate and provide the best service to your patients. So I guess I would end there. And I think we have some time for questions.
We do, and we have quite a few in the chat. So I'm going to do my best to get through and kind of summarize ones that are similar. One of the questions that we got the most is about the EMR integration piece. So for calls that are handled by the attuned agent, is a telephone encounter automatically created in the EMR? Is that labeled as AI generated? Can you just speak more to how that process works?
Yeah, so it depends on the type of use case. For, say, a prescription refill, we do document that in a telephone encounter back in the EHR, and we do a summary of it. And the information that comes back on that encounter does show that it was generated by Attuned. So it's very clear that it was not a person or a provider, and that it was automatically generated through the Attuned system. So that is that. In other use cases where we do scheduling and those types of things, the outcome is the schedule or the cancellation or the reschedule. And we generally do not write back for that. We have an audit file. Every conversation is recorded, transcribed. You can listen to it afterwards. You can look at the quality of the scores, and we evaluate each call during the call and after the call to provide a kind of a high level overview of that. And so that's all in the system. And so if there are issues, we can always go back and take a look at it and see what happened.
And I guess the next question we'll go to is, how do you kind of triage patient calls into different buckets like appointment scheduling, cancellation, refills? What does that look like both on the health system side as well as on the technical side?
Yeah, Rainier, do you want to take that?
Yeah, so when individuals call, they're having to make their selection of the language, setting up the language, sets up in a sense the conversation. From there, the AI will, let them know what is it, how can we help you today? And the patient will then go in any type of direction. The AI would then, in a sense, scrape up every type of information. So if it's pertaining, for example, a refill, it will initiate the lookup. It will initiate, the documentation within Epic to then be able to go ahead and route that request over to the prescribing provider. So if it is for behavioral health, it will go to the behavioral health prescriber. If it's primary, it will go there. If it's pertaining to an appointment confirmation or finding out when my next appointment is, it all varies, but it all depends on the conversation that the patient has with the AI. And it's what they share in a sense. And that goes back to building the trust, because a lot of people give one word answers. But the more that you interact with the AI, the more your conversation seems seamless. But a lot of it gets tracked. So if a patient does cancel the appointment, we will get notified on our side. Like we will see that, it's canceled via, the Attune platform, via my chart, via, for example, if it was a staff cancel. And like we will be able to track all that.
Awesome, thank you. How are patient identities verified over the phone before kind of sharing or modifying account details?
Yeah, so we can do multiple different ways. For Lowell, what we use is phone number, date of birth, and name. Other places, what we do is phone number, date of birth, and zip code. And that works well. So it's up to the organization. That seems to be kind of the optimized way to do it. But yeah, we can work with however makes sense and however you have it set up.
Awesome. And I think relatedly, what does the patient disclosure or like consent process look like?
Yeah, I mean, it is every time we answer a call, we say that this is a virtual agent, and that consent is currently implied for them when they continue, and we feel like that works because if they ever ask for an agent or a human or a representative, we transfer them right away. So we don't keep them on a line and torture them when they are looking for talking, to bypass the virtual agent.
And I am going to just take an opportunity to remind folks if you have a question that you definitely want to make sure it gets answered, feel free to raise your hand and I'll call on you to unmute and ask. But the next question I will pull from the chat is, does the tool have speech emotion or recognition capabilities? Can it detect, for example, distress, frustration, emotional urgency during a call?
Yeah, so we don't look at volume or pace of speech. It's more the terms and the concepts people are bringing up that will raise our concerns. So if they're using, vulgar language, we're going to say, "Oh, this person is upset for some reason. We need to transfer them right away." And again, we want to make sure that we ingrain that trust. We, work with the callers to make sure that they trust us. And by doing that, to do that, to get the trust, you need to make sure that they are getting to a person whenever they need to. So if we hear that someone is having a clinical issue where they have symptoms or emergency or anything like that, or if they're frustrated or anything like that, we transfer them right away to a person because it's just not worth the time. Um, and we want to make sure we get that trust.
Thanks. Rainier, could you speak to kind of some of the patient reactions and have you received any feedback around like dissatisfaction with the tool or any hesitation around using an AI agent with kind of answering and addressing some of these calls?
Yeah, so it's been a mix of positive as well as I can't say fully negative. It's just more of just patient education and understanding of what the features are available. So you may call and you requested to get transferred to the pharmacy, and that was very helpful. But then the next time you call, you wanted to talk to your primary care doctor, and you asked for that. But that's not an intended feature that is, live. So some people got frustrated because of that. Also, some people originally were a little bit frustrated because they were just used to the original way, which was you call, press language, wait for the representative. But with the time, with individuals coming in and with us, educating, informing our own staff to allow them to also educate our patients of like, hey, look, you can do all these type of, features and all these type of requests that you're looking for. You can do them also through, the AI because a lot of our patients could do a lot of these things through my chart, but some of them don't have the capabilities to get onto my chart. So I can think it's a little mixture of both, but I think it's just surrounding not understanding and just working with those individuals. At the beginning, it was a little bit rocky, but over time, it has really smoothened out a lot.
And I think that takes us a little bit to also the procurement process. What were kind of the reasons that you all were looking to switch to using a voice agent, and what did that procurement process look like for you?
Yeah, so I think it's surrounding, everything we tried. Within our current phone system, we try call tree, so we put different options that in different departments that patients could get transferred to, but that's really putting the trust on the individual or the caller selecting the actual option. But as I referred to before, everybody's looking for the quickest, fastest service that they can possibly get. So what we encounter was a lot of individuals just making selections of like, yeah, I'm gonna press HR, even though my call is not pertaining to HR. But if they answer, then they can help me. So we started to realize that a call tree, for example, was not useful. We also tried the option of, shifting staff around for the different types of times throughout the day, and to try to find a balance, but we still were striking out. And in the perfect world, you would love to have 30, 40 representatives, but ideally that's not, efficient, as well as you always constantly have, turnover, which means that you have to train new staff and it takes time to get them up to speed. So this is when the organization decided, like, we can have this type of feature. We can input so much information, it can remember, and we can make tweaks to it. So overall, we tested other options, but then, we went with something new to try something that we have never tried before.
And what did the integration process look like? How did your existing staff in the contact center or in the call center react to the tool? Did you do any sort of co-design process as you integrated this? What did that process look like?
Yeah, so for a lot of the staff, nothing really changed when it came to how they answer the calls. For them, the more shocker, item, which is the shocker item of everybody, is like, hey, would this be taking my job? In a sense, the way I see it is more of the tool being here to allow you to focus more on those complex patients, and then it allows us to provide, quicker, faster service. So in hopes of, less patients being upset because it's like, hey, I've been waiting 30 minutes and I can't get through to a live individual, but all I wanted to know is what is your fax number, for example. So it's those little things that really frustrated our patients, but we also needed to explain to our staff of like, hey, look, these are going to be the benefits of it. It's going to provide quicker, faster service for our patients, and it's going to allow you to really take that time to work with that patient longer, instead of you looking at a queue and you're seeing, 25 to 30 people waiting, and you're kind of like impatient or anxious that, oh my God, we have so many people. Oh my God, we have so many abandoned. So at first it was just more of explaining to staff that, hey, your workflow is not going to change. You're still going to come in, you're going to still answer calls, you're going to still help our patients, but there's another tool helping you, complete a lot of the everyday tasks that are, coming through the phone line.
I love that you are really highlighting the importance of like patient education and end user education, because we've seen time and time again that has just been really critical.
Yeah.
In terms of training of the Attuned Intelligence tool and then monitoring post-deployment, Brian and Rainier, what does that look like for on both ends?
Training from to use the platform. Is that,
I'm looking back
or
at,
is it training of the AI agents and making sure that the AI agents is doing what it's supposed to,
I think
like validating?
more of the latter.
Okay. Yeah, so we have a pretty strict process around change control, and but we can go pretty fast. So we generally have 3 to 5 meetings with the organization to create a custom agent. During that time, we identify what are the locations that people need to be transferred and what are the reasons for them to be transferred there. And then we build the custom agent. We have automated ways in which we test those agents en masse, many different automated processes for testing that before we then provide it to the organization. We then go to the organization, go to Lowell and say, hey, here's a number, call this agent. Here are the scenarios. Please verify that all these things are working correctly. They're saying the right things. They're going to the right places. And then what we do is we turn it on once we get sign off from the organization. We turn it on for an hour. We monitor for an hour, looking at every call, and then turn it off and evaluate what are the optimizations that we can make. And then the next day we turn it on for 2 hours. And if we still need to make optimizations, we do that. We turn it off. But generally, after 1 or 2 sessions of live testing, after all of those different testing sessions, we're able to just keep it on. Rainier, I don't know if you have any comments about that.
Yeah, so I think it's a lot of it. I come more from the operations, so it's in a sense feeding what we currently do in the call center and having in a sense the AI be able to in a sense replicate a lot of that from the operation side. But I think is to Brian's point, being able to do those small testing blocks, being able to constantly see and be able to tweak what's happening, be able to test, for example, a certain scenario, but then realize like, hey, it's not translating, one to one because we have, Portuguese, for example, Portuguese from Portugal, Portuguese from, from Brazil, and it's definitely different type of translation. So one of the first things that we realize is like, for example, if we use or refer to HIM for health information, at some patients or in some of the translations, it was a little bit not translating one to one. So we went with more of medical records, and that was better received. So it's really making those tweaks, testing, and being part of those communications, not just letting Attune do all the testing and we don't have nothing part of it. It's just like they do a lot of the engineering, we then get together, then we test, then we make our comments, they make adjustments, we test again, and then we can really set it loose, because it goes back to building that trust.
Absolutely. And from almost a qualitative perspective in terms of post-appointment monitoring, do callers have an opportunity to kind of rate their satisfaction and provide feedback on their experience with using the tool? And what does that look like?
Yeah, we've actually talked a lot about this and offered it to organizations. Generally, surveys and that type of stuff is not super well received by callers. And so we use surrogate markers. We look at how often are people asking to speak to an agent? How often are they just not responding? How long are the calls? How long are they interacting with our agents? And those are good surrogate markers for looking at the engagement of it rather than providing, the questionnaires afterwards. And for Lowell specifically, when we turned it on, I think 40% of the patients said, agent, human, I want to talk to your supervisor. um, but we were then able to put in a question after, I think about a month. We said, if they said agent, we said, in order to help you to get to the right place, can you tell me a little bit more about why you're calling? And then they would say something. And we got that down to about, I think ranges between like 10 and 12% now of people saying agent or person. And so that's been a really great progress of that trust that you're getting from the callers, and they're starting to feel comfortable with interacting with it and getting what they need. Rainier, I
And
don't know if, yeah.
Oh no, I think that's good summary around it. I think that it's a lot of individuals really trusting into the product, and trying it out, because at first it was just like that. It was just they we had the options to press buttons, and one of the options that we had is our priority queue, which is our option 9. Well, when we partnered with Attune, we had large volumes of callers going into our priority queue that were not hospitals, that were not providers, but this, even after this got implemented, people were pressing, you can see in the transcript 9999 because they're trying to get expedited. So it's really to that point that Brian mentioned is really helping our patients understand and educate and understand like, hey, look, follow the information in the prompts and you'll be able to get a great service.
Definitely guilty of having pressed that button multiple times. But I think that's all the time we have for questions today. Thank you all so much for your presentation again, and thank you to our audience for great questions. And I will hand it back to Wes to close us out.
Great. Thank you, Sierra. And thank you, Brian, at Attuned and Rainier with Lowell Community Health Center. What an engaging and really rich discussion and conversation. I think there was a lot of questions. So I'll work with you both to see if there's any unanswered that we could do, put into our follow-up, because we, of course, got registered questions as well that came in. So if there's anything there, we'll follow up offline. And with our registrants and attendees, we'll be sure to follow up with responses to those questions. Thank you, Brian. He just dropped his email in chat. If you have any further questions, I want to dive deeper into Attuned Intelligence and their services. What topics should we see for AI in action? And who should we hear from? I dropped in chat a survey. Please complete that. It only takes a couple of minutes. We'd love your feedback to really help shape future sessions. Maybe you have on the ground experience that you'd like to share in implementing AI in the healthcare safety net. There's an interest form there to speak to it. We're open to it. We received it and we'll follow up with you accordingly. And then also we do have our next sessions coming up. I'll just quickly click through these through November and even through December. That'll be up on our registration events page, both through Health AI Partnership and with us here at the Center for Care Innovations. The link is there. Visit and register for these upcoming sessions as we get to the top of the hour. We have some sessions featuring dental AI use and building AI governance with Fenway Health in Massachusetts. We have featured podcast speakers and family care physicians, Dr. Lalita Abhyankar and Dr. Kelly Nieves, speaking on the 85 years of community-oriented innovation and how this rich history of FQ's guide today's AI implementation. That will be a fascinating conversation. And then in November, we'll have Dr. Amanda Asher, CMO of Sun River Health in New York, speaking very candidly in a conversation around stories from the front line. So be sure to register, complete our brief survey, and we're at the top of the hour. Again, Brian and Rainier, thank you for joining us today. For our registrants and attendees, you'll receive the recording and the follow-up information. Brian's email is there in the chat, and thank you all again for attending.